We're here at the Mills and Reeve Mental Health 2012 and Beyond conference at the King's Fund. With me is Andy Bell from the Centre of Mental Health, an independent charity working to improve people's lives in mental health. Andy, what's the most important issue for you in the delivery of mental health in the next 2 or 3 years?
There's some huge challenges ahead, and I think the main one is obviously we've got to keep moving from the huge improvements we had in mental health services over the decade that's just come, but we've got to move on to intervening much more quickly when people develop mental health problems rather than waiting till things reach a crisis. We've got to improve the quality of people's lives, so we've done masses to improve community mental health services, but we don't yet have equal opportunities for people with mental health problems to lead the lives they want to lead for themselves. And we've really got to integrate services around people rather than forcing people to revolve around services.
Early intervention sounds good. What does it mean in practice?
What it means is being sure that services are there when people first become unwell or first see the signs of problems. And it can be early intervention at any age. We know, for example, that if you intervene between the ages of about 3 and 12, when someone's first developing behavioural problems in childhood, that if you do the right things at that stage, you can support parents to reduce the risk of not just behavioural problems at that time, but a whole range of adverse outcomes in later life. We also know that if you intervene quickly when, say, a teenager is first developing the signs of psychosis, not with medication, but with proper support to lead the lives they want and to manage the emerging condition, then again they can have a much better quality of life, and you know, you can keep people on track at those very crucial moments in their lives. But it works throughout the life course. You can also do it in older age when people are first developing the signs of dementia, for example, and the depression that very often comes with that.
It sounds great. How do you put it into practice in a time when we're under financial constraint? I mean, it doesn't sit right with cuts, does it?
It's incredibly difficult, and I think this is the major problem we've got, is that we know we need to intervene early, and we need to shift the focus away from only ever dealing with a crisis. But of course, when money is short, that's both threat and opportunity. It's understandable that commissioners are wanting to retrench and focus on the must-dos. On the other hand, if you invest in early intervention, the costs overall will go down over time. So it's about doing things incrementally and wisely and making the best use of the money we've got at any given moment.
Do you not think that GPs may feel that price is something they have to consider perhaps over quality? How do you deal with something like that?
I think the evidence is fairly clear across healthcare that if commissioning is done on the basis of quality and you have competition on the basis of the quality service you give, you can have improvements. If you start having competition on the basis of price, it becomes the game for the lowest bidder, and that's very dangerous. So we need to make sure the system is designed so that price doesn't become the primary issue when people are making decisions about what services they purchase.
Interesting times. Where do you think we will be in 3 years' time? Not where would you hope we will be?
I think we'll keep making progress. I think there are signs that some GP commissioners are uncertain about mental health. Others have a real passion for it. And I think the development of the new system will have, again, threats and opportunities, but we will see people beginning to make progress. We will see more innovation in the way people are developing, for example, recovery-focused services, as well as early intervention and integration. And yes, times are going to be really, really testing, and we're going to have particularly a year of transition which is going to be disruptive. A lot of the great innovations happen on the basis of stable relationships between different services in a locality. We need to try and maintain some of that if we can. So there is going to be some turbulence, but I think we'll keep making progress.